great educational content that has grown to over 3 million people following me. And I have a book coming out soon. A lot of good stuff happening because of it. But, since what's been happening politically has affected everybody from a public health standpoint, I've kind of taken a sidestep to be able to help educate and clarify all of this incorrect information that keeps being spread that's confusing people when we're in the midst of a measles outbreak.
Yeah.
I'm double certified in pediatrics and allergy. I maintain my pediatric certification. And so I do a lot of content educating people about pediatrics, about how that affects everybody. And I want to make sure that our children are safe because children can't advocate for themselves. It's really important that we as grown-ups advocate for them.
I love that so much. We formed the first Democratic Doctors Caucus this Congress because we finally have a critical mass of Democratic doctors. And we take our role as representing physicians in Congress really seriously. And we feel like we have this obligation, certainly, to counter the misinformation that's now coming out of HHS with our new secretary. And your example of how to reach people and make it accessible and trusted, I think, is so important. I'm curious, how do you think that this big, beautiful law now is going to impact patient care?
Really tough issue because not everything's going to happen right away. I think people don't realize that a lot of this stuff's going to happen after the midterms. In December 2026, when we start seeing work requirements being put into place, seeing about $1 trillion of Medicaid funding being cut, a lot of that strain is going to be pushed to the states, which will then be pushed to the more vulnerable areas, the safety net hospitals and rural facilities. We've already seen a lot of hospital beds going in places that are most vulnerable. And now we're seeing, and I see this in my clinical practice, where people are traveling hours to see me because the lack of specialist care in rural areas is very hard to come by. So the wait lists can be very long to find specialists for some people. And so it's not going to happen right away. We're going to slowly see some of these facilities start to close down as that Medicaid funding gets cut. And then that's going to end up causing a lot of people who go off of the insurance, which we estimate anywhere about 12 million people are going to lose their insurance because of this.
I've heard
Those
estimates
people
of
are going to end up
17.
using,
Yeah.
it's devastating. Those
Yeah.
people are going to end up going to the emergency room as their form of primary care. When they get very sick, they're going to go to the emergency room. What's that going to do for everybody else? It's going to increase the wait times and decrease the quality of care. Then the hospitals have to eat that cost because of EMTALA, and that cost gets pushed onto health insurers, which then gets pushed onto the privately insured patients, who then many of them won't be able to afford their health insurance anymore. They'll go off of it, and it's going to be this ripple effect, whether physicians take Medicaid or not. We're all going to feel it. We're going to see people leaving practices. They're not going to be able to go to specialists until they're very sick. And so our overall patient demographic is going to get sicker as a result because they're not going to get the type of preventive health services that they need as a result of the long-term effects of this bill that are not going to be seen right away. It's going to be seen years down the line.
Although there may be some ahead of time because hospitals have to plan. And, we're already seeing, so we already have a crisis, certainly in rural healthcare. Rural Minnesota is definitely true, and across the country, hospitals are closing. I worry a lot about obstetric care. I'm an OBGYN, but I worry a lot about pediatrics too. Because, as you well know, almost half of American kids get their health insurance through Medicaid.
Right.
So, and we already don't have enough pediatricians. And it's one of the lower paying specialties. So fewer people are going into it. We're now making it harder to pay for medical school because it's harder to get loans now with this bill as well. That hasn't been talked about a lot. So we're creating this perfect storm of fewer providers, fewer clinics, fewer hospitals, just overall less access for everyone.
Right. Let's talk about those loans for a second.
Yeah.
The federal loans for professional students, those who go into medical school, is being capped at $200,000, which, if people aren't aware, medical school has been astronomically expensive. It's generally about $75,000 to $100,000 a year just for tuition. That doesn't include room and board, all of the other extraneous costs that go into the education. Unless you're getting a PhD or some kind of really good scholarship, you have to come from means in order to be able to go to medical school, or rely on these federal loans. And so by capping it, it's going to force a lot of people to either not go, we have to rely on wealthier people to go, or it's going to push people away from primary care because it's the lowest paid specialties. As you said, pediatrics is one of the lowest because of the way that we have a fee for service model that it rewards the procedural based specialties, and the ones that primarily are clinic based don't get the same type of reimbursements, and you end up having to see a lot more patients with fewer amount of time, which also decreases the quality of care. We already have a doctor shortage. We're going to see more and more of an issue with getting primary care, and which will end up being helped by our nurse practitioners and physician assistants, but it's not going to be enough to close the gap.
The many things I worry about with Secretary Robert F. Kennedy Jr. Are his attitudes about vaccines, and he continues to peddle bad information, just not factual information about vaccines. And his most recent thing that I saw is that he's claiming that doctors are incentivized to give vaccines, that they're reimbursed much more for giving vaccines. Do you have a perspective on that as a pediatrician?
Is that most pediatricians either basically make at cost, maybe a little bit, but a lot of them end up losing money. We saw that with the COVID-19 vaccines. You end up losing quite a bit of money, especially if you're a small private office and you have to get those specialized freezers. That costs a lot of money. And unfortunately, with all the misinformation and the lies that have been spread, people have been confused and not wanting to get vaccinated. A lot of doses have been wasted too. It's really a net negative because you get paid for the supply and the administration of that vaccine, but that barely covers the cost of overhead. You've got to pay your staff, you've got to pay for the rent, for the space to do it, for the time it takes. That's going away from seeing patients for other reasons. So you don't really make a lot of money off of it. And again, pediatrics is one of the lowest paid specialties. It doesn't make any sense why they're getting picked on other than from an anti-vaccine standpoint to try to say, well, the reason why pediatricians want to do this is because they want to make money. And that's far from the truth. If anything, if healthcare was about really a sick care model, we wouldn't want people vaccinated because it would make more people sick and have more long-term issues. But
Exactly.
instead, people who want to talk about supplements and other alternative therapies, they're going to end up making a lot more because of it.
That's so true. And I think sometimes too, I know in my practice as an OBGYN, we of course give vaccines. The HPV vaccine is one that we talk a lot about. And I think the mis and disinformation around vaccines has also led to providers having to spend a lot of time talking about vaccines. And that's okay. It's important to ask your provider questions. You want to make good decisions, but that takes away from talking about all the other important preventative health things. I always say some of the most important things that I know I do as a doctor are just listening to my patients and then talking to them about ways that they can be healthier. It's not the stuff that you do to people, it's the trust and the conversation and the life planning in a lot of ways.
Right.
There's sort of another insidious way that all of this vaccine misinformation takes away from that doctor-patient relationship, I think.
Cannot agree with you more on that. It really does take a lot of time away from being able to discuss other issues when we're already limited on time to begin with, and we have to see a lot of patients in order to essentially keep the lights on. Again, being efficient is not just taking care of patients, you have to take care of your staff as well and make sure they're not overburdened. But these issues eat up a lot of time.
You mentioned EMTALA earlier, and I just want to make sure that folks understand that that is a law that requires hospitals to provide life-saving care to patients. I think it's a really cool American value in a lot of ways that if you show up in an emergency room, you are required to receive the care that you need. And I think it's something that I think it's something we should carry into the rest of our healthcare system, that everyone deserves access to healthcare. And one of my big concerns with this big, beautiful law that's just been signed that I think should be probably called Trump Care because this is the president's approach to healthcare in the United States, is that it's going to decrease access dramatically and decrease for everyone, but particularly for the people who are the most vulnerable and in many ways need it the most.
Right. And unfortunately, a lot of the tax breaks that are happening, that money could have been used to help fund healthcare in this country. And instead, It's really skewed the ability for people to get access to healthcare, and we're going to see more and more people getting sick and developing life-threatening issues, or they're going to miss their cancer screenings. And there's a lot of concerns about what's going to be the next steps with Health and Human Services Secretary, which he gutted the Advisory Committee on Immunization Practices. Now there's concerns he might end up gutting the U.S. Preventive Services Task Force, which makes the recommendations for mammograms, for cancer screenings, for
Mhm.
STIs, right? All of these different issues may end up not being covered, even though technically we still have the Affordable Care Act. It's essentially being gutted by this law.
It is. And we haven't even touched on all the cuts to medical research, funding of universities. We are just ceding our role as the world's leader in medical breakthroughs.
One of my friends from high school who I saw recently, he's an MD PhD program and he wanted to be a physician scientist, and now he can't do that because there's no available funding to do the research portion. So he's not going to be able to follow his dreams to be able to find breakthroughs in gastroenterology. And these stories are happening all over the country. And there are scientists who are leaving. We're experiencing a brain drain right now.
That's exactly right. That's exactly right. Doctor, what is some of your best advice for parents, for people who are trying to weed through all of this information? Some good, a lot bad. What's your best advice to people to on how to figure out what the right thing to do is and what is good information?
Right. I still believe in what our medical society are able to put out in terms of information. We already see the American Academy of Pediatrics is going to create their own vaccine advisory committee and make recommendations. I would love to see health insurers follow those recommendations right now because the current committee is not reliable by any means. We have that. We have the American College of Physicians. We have ACOG. As there's different medical organizations that have experts within their fields that create these practice parameter guidelines that are evidence-based that we as physicians often look to help. That's a great resource. There's a lot of materials that are meant for patients to take a look at. But then talking with your own doctor is important to address these different concerns that you may have. It's one thing to go on social media and ask for help, and I'm doing that on a regular basis. But a lot of people on social media are not necessarily reliable, and it can be difficult to figure out what to do. Obviously, you can vet people's credentials. You can look at my credentials online and see that I do maintain both dual certifications and see patients on a regular basis. A lot of my patients follow me, but not everybody on social media is credible. You have to always be skeptical and lean in on the people you actually know in person, whether that's your physician or looking to the medical societies for help.
It's great advice. That's great advice. Dr. Rubin, thank you so much. I'm so grateful to you. I know how busy you are. Thanks so much for taking a few minutes to talk. Let's stay in
Really
touch.
nice to meet you. Thanks for having me, and I'm happy to help out any way I can. So feel free to reach out.